The recommendations of the CQC are taken very seriously. They're all reviewed. We have to give them a plan within 12 weeks of how we're going to address them and with a clear timetable of what we're going to do. Now with our services in A&E, we have a good plan. We've already implemented a number of changes. They wanted changes to the mental health assessment room to make sure there were no ligatures and there were no dangers to patients who are kept in there to be assessed. And they wanted some changes to our basic practices about how we lay out our emergency equipment so that it's the same in every room, which just saves time if you are in a real emergency. We've opened our urgent treatment centre. That's now seeing 50 people a day, so the weight has been taken off A&E. Our numbers are much better, our performance is better, so I think if they came back this week, we'd already have shown really good improvement. So we're disappointed that to find out what they saw, but the improvements that they've given us, half of them are implemented already. The rest will be done by Christmas. Every CQC inspection, so we've had 3 in the last 5 years, each time we've got better and stronger. We're on a very clear path of improvement. If you look at maternity services, although they're still labelled as requires improvement, they've made tremendous improvements to safety and to the care of the women who use the service. The feedback from our women, having introduced one-to-one care with midwives, is fantastic. So we've got some great services, and even with the CQC overall requires improvement. 6 of the 8 services they've looked at in the last 2.5 years are good. So most people are getting a good service when they come to the hospital, but clearly still room for improvement, and we're very open to criticism from the CQC and other inspections that we get, and we always respond very quickly to improving services. On the issue of are the services here to stay on the Bedford site, then that's what we've said. Both the chief execs, both the boards of both hospitals want to keep all the services on both sites. A key factor in that is the population is growing so quickly around Bedford and across Bedfordshire that if anything we're going to need bigger hospitals, not smaller. Even with all the care in the community, which we fully support, all the care in primary care settings, we're still going to need all the services we've got in the hospitals for the foreseeable future, just to meet that growing demand.